So epilepsy is curable. Epilepsy can be cured with, I think, a team effort. So anything that is new, anything that is recurring spontaneously, anything that is happening again and again in a stereotypical manner should alarm someone that, okay, this is not right, this is not normal, and this needs to be addressed.
Hi guys, this is Vinay Divan and you're watching TheHealthSite.com. Today, on the occasion of International Epilepsy Day, we have with us Dr. Rima Chaudhari, Senior Consultant Neurology, Fortis Hospital. Hi Dr. Rima, how are you?
Hi Minnie, I'm doing good. How are you?
I'm doing great. I hope things are keeping well at your end as well.
Of course, thank you.
So as we all know, it's International Epilepsy Day. I think the very first question that comes to my mind right now, and I would like you to enlighten all our viewers and listeners with, is what exactly is epilepsy in, a very layman and general terms.
Correct. So thanks Minnie for having me on the show today. And yes, it's a privilege to talk about anything relating to epilepsy. And what bigger than talking about it on the International Epilepsy Day. So sure, epilepsy is nothing but having seizures. Okay, so seizures is any abnormal neurological activity or any paroxysmal activity of the brain that is abnormal. So it can cause someone to have a jerk, it can cause someone to just pass out or lose consciousness, it can have someone just feel some numbness or tingling for a certain period of time. So it can be in various forms depending on which part of the brain is generating the seizures. But most importantly, epilepsy is anything that is paroxysmal and that is transient and affecting for a short period of time, right?
Okay. In that case, doctor, since we're talking about seizures can also be of various types, right? Are there any distinctions as to what kind of seizure it is or what particular types of seizures exist?
Yes, sure. So seizures can be of various types. The commoner ones are the focal and the generalized seizures. So focal meaning, which the name implies, it begins in one part of the body, then spreads to the entire body. And generalized typically involves the entire body at the get-go, at the beginning itself. So yes, it's important to differentiate the two types of seizures because the management for both the types is different. And it's important to differentiate to start the treatment as early as possible, depending on the type that it is.
And if we talk about the causes and the symptoms of, epilepsy, and how can one really identify that something is really wrong and now is the time to visit the doctor?
Good, that's a good question. Yes, so anything that is new, anything that is recurring spontaneously, anything that is happening again and again in a stereotypical manner should alarm someone that, okay, this is not right, this is not normal, and this needs to be addressed. And like I said, it can be any transient phenomena. So it can be some subtle change in speech for some time, it can be jerking of a limb for some time, it can be some sensory phenomena in a limb, like feeling some tingling sensation or seeing some abnormal thing transiently for a certain period of time. So it can be varied things. As long as someone perceives that this is stereotypical, it's happening unprovoked, it needs to be addressed, and they definitely need to see their neurologist. Yes.
Yeah. And then once you identify the symptoms or once you know that there's something really wrong, what should be the first step like? What should be the first thing that a patient needs to do?
Correct. So once they have reached the doctor, their doctor is going to run them through a series of tests. So first, most important thing is a good history. I always stress on that. So a vigilant patient is going to report their symptoms very clearly. So what happened before the symptom, what happened during the symptom, and what he experienced after the symptom. If the patient is unable to do so, my advice is it's always good for a caregiver or an onlooker to just make a simple video on a cell phone. I mean, that's available now. Sometimes it's very hard to describe the nuances of what's going on. So it's not a bad idea to just get a home video, and that gives a lot of information to your doctor. So the doctor is going to run you through a series of tests, give an accurate history of what medications you've been taking. Is there any family history of something similar? So all of that is going to be put together to start the correct treatment for the patient.
Yeah. And having said that, if we talk about the treatment process exactly, what is the treatment like? Is it treatable to complete recovery mode? Also, are there any advancements in the treatment process over the years?
So, treatment, definitely the goal of treatment is going to be to alleviate seizures. So, patient who is doing well with one medicine, we are in good shape. We don't need to do much. But if we see that the patient over a period of time is not responding to medicines, then definitely we have to work this patient up for an epilepsy surgery. So, why do we talk about it? Because, see, having recurring seizures is not something that is the goal of life for these patients. Their quality of life is completely hampered with recurring seizures and with the overburdening of the medications. So it's good to rule out that the patient is not a candidate or is a candidate for surgery and then work them up accordingly, because we can definitely help these patients with this. And like I said, there are several therapeutic options available. You have neuromodulatory therapies, you have resective surgeries. All of this can be done depending on the type of seizure that the patient has.
I think that's pretty summed up, doctor. Any last words or any advice for all the viewers or the listeners that you want to say from your end?
Yes, sure. So epilepsy is curable. Epilepsy can be cured with, I think, a team effort. At Fortis, we do have a team who we have a comprehensive approach towards treating these patients, and I think it's very important to just have that faith that all of this can be taken care of, provided you reach the right experts. So yes, don't be scared, and people can lead a very normal quality of life with seizures. Yes, thank you.
Yeah. Thank you so much for joining us today and enlightening all our viewers with such wisdom. Thanks a lot.
Thank you, Minnie. Pleasure. Thanks.
Bye bye.